Let's go over the 5 most common lacunar syndromes covered by Blumenfeld. First of all, lacunar infarcts are small subcortical infarcts, less than 1.5 centimeters, related to occlusion or stenosis of small penetrating branches of the MCA, PCA, or basilar artery, including the lenticulostriate arteries. Lacunes are frequently associated with chronic hypertension. These are the 5 most common lacunar syndromes that we're going to go over. The first one might seem a little overwhelming, but Lacunar Matata.
Lacunar Matata.
The most complicated one is pure motor hemiparesis or dysarthria hemiparesis. It's complicated because it can be caused by infarcts in several locations involving several different blood vessels. Pure motor hemiparesis is characterized by unilateral face, arm, and leg upper motor neuron type weakness with dysarthria. In other words, purely motor symptoms, with dysarthria being a motor issue related to articulation problems. The most common infarct locations for pure motor hemiparesis are the posterior limb of the internal capsule and the ventral pons. The internal capsule is a bundle of nerve fibers that runs between the thalamus and the basal ganglia. It consists of ascending sensory fibers that carry information from the thalamus to the cortex, and descending motor fibers that transmit signals from the cortex to the brainstem and spinal cord. I remember the internal capsule because I think of an intern running around and carrying messages for people. The internal capsule is supplied by the anterior choroidal artery, the lenticulostriate arteries, and the perforating branches of the posterior cerebral artery. How are you supposed to remember that? Well, internal capsule makes me think of interns, and interns work a lot of different places. Some interns are training to be chorus instructors. This reminds me that the anterior choroidal artery is one of the arteries that supplies the internal capsule. Some interns work for gangs, like the infamous basal ganglia gang. The lenticulostriate arteries are small branches of the MCA that supply the basal ganglia and parts of the internal capsule. I remember this because it starts with Lent, and maybe gang members who are Catholic decide to give up the gang life for Lent. The internal capsule, that whole bundle of fibers, just shuts down until Easter when the basal ganglia starts working together again. And some interns have a little more vision than that, and they want to be postdocs eventually. Of course, the posterior cerebral artery is associated with vision. Moving on to the ventral pons, the other common location for these infarcts. The pons is a part of the brainstem involved in respiratory control, sleep regulation, and facial movement. It contains sensory and motor pathways and nuclei for cranial nerves 5 through 8, which are involved in various sensory and motor functions related to the face, eyes, and ears. So pure motor hemiparesis is usually caused by infarcts in the internal capsule or pons. To remember what blood vessel supplies the pons, I think about a pond, because pond sounds like pond, where people are doing underwater basket weaving, because basilar starts with bas. By the way, damage to the pons causes locked-in syndrome.
They won't let me out.
So anyone with damage there would suck at underwater basket weaving. Less commonly, pure motor hemiparesis or dysarthria hemiparesis can be caused by infarcts in the corona radiata, which is supplied by the small middle cerebral artery or MCA branches, or the cerebral peduncle, which is supplied by the small proximal posterior cerebral artery or PCA branches. The corona radiata, well, it has 2 parts. The anterior corona radiata consists of fibers that run from the precentral gyrus, or the primary motor cortex, through the internal capsule toward the brainstem and spinal cord. It helps control voluntary movements. The posterior corona radiata consists of fibers that carry sensory information from various parts of the body to the postcentral gyrus, which is the primary somatosensory cortex. You can remember that the corona radiata is supplied by the small MCA branches because the middle child of the family is always upset about being the middle child, middle child syndrome.
Well, all I hear all day long at school is how great Marcia is at this or how wonderful Marcia did that. Marcia, Marcia, Marcia!
So they drink a lot of Coronas to cope. And what's the cerebral peduncle? These are ascending and descending tracts in the ventral aspect of the midbrain that carry signals from the cerebral cortex to the spinal cord, brainstem, and other areas of the brain. Damage to the cerebral peduncles can result in muscle weakness or paralysis, sensory deficits, and problems with coordination and balance. You can remember that the cerebral peduncles are supplied by the small proximal posterior cerebral artery branches because peduncle sounds like dunk, and in order to dunk a basketball, you need good visual skills, and the PCA is what supplies blood to the occipital lobe. Now we're done with the most complicated lacunar syndrome. The next one, ataxic hemiparesis, is easy because the symptoms, infarct locations, and blood supplies are all the same as pure motor hemiparesis, except there is also ataxia on the same side as the weakness. Ataxia is a lack of voluntary coordination of muscle movements. The next lacunar syndrome is pure sensory stroke, also known as thalamic lacunar. As its name suggests, it involves purely sensory symptoms, namely sensory loss to all primary modalities in the contralateral face and body. It's caused by infarcts in the ventral posterior lateral and ventral posterior medial nuclei of the thalamus. The blood supply for these thalamic nuclei comes from the thalamoperforator branches of the PCA. The next lacunar syndrome is sensory motor stroke, or thalamocapsular lacunar. As its name suggests, it's a combination of the sensory symptoms from the thalamic lacunes and the motor symptoms from the pure motor hemiparesis, and the possible locations are basically the ones described for those syndromes: the posterior limb of the internal capsule, and either the thalamic VPL and VPM, or thalamic somatosensory radiation. As we talked about, the blood supply would come from the thalamoperforator branches of the PCA, or the lenticulostriate arteries. Then finally, we have the syndrome of basal ganglia lacunes, which are usually asymptomatic, but may cause hemiballismus, which is a rare movement disorder characterized by sudden, involuntary, and violent flinging or jerking movements of one arm and/or leg. You've heard of people going ballistic, so now just think of someone going ballistic with these wild, flailing motions, but only on one side of the body. Basal ganglia lacunes can occur in the caudate, putamen, globus pallidus, or subthalamic nucleus. These areas are supplied by the lenticulostriate, the anterior choroidal, or Hübner's arteries. We already talked a little about the first two, but Hübner's arteries are small blood vessels that arise from the anterior cerebral artery, or ACA. So now we've covered all 5 common lacunar syndromes.
Lacunar Matata.
Please like and subscribe. I make these videos for free.